Good evening, good afternoon, good morning to everyone, and uh, esteemed speakers and guests. We are deeply grateful for your presence at our forum on international campaign to support the health sector in Sudan. I am Mohanad Nsour, the Executive Director of the Eastern Mediterranean Public Health Network, Infinite, and it's an honor and pleasure to welcome you all. Since the conflict erupted in April 2023 in Sudan, thousands of lives have been lost and millions have been displaced, creating the largest displacement crisis in the world. Preventive and curative services has been disrupted. Medical supplies are critically low, and healthcare professionals are overwhelmed and stretched to their limits. Despite all these and different, severe challenges, the health system in Sudan has shown impressive resilience. In this critical time, Eastern Mediterranean Public Health Network Infinite has taken a proactive role in responding to the crisis or in contributing to the crisis and standing with Sudanese people through supporting the health system in Sudan. Our last visit to Sudan in May 2024 revealed that the situation is so and far more severe than commonly reported or what we had seen. Infinite is committed to contribute in supporting Sudan through coordinating emergency response efforts, system strengthening, capacity building, and resource mobilization to address the immediate health needs and ensure the long-term resilience of Sudan's health system. However, those goals required a unified efforts, coordination, and commitment from all stakeholders, partners, sides, and the international community, of course. I remember, allow me here to say that I remember very well, and during our visit and meeting with His Excellency Ambassador Hassan Suward Dahab in Amman last May, and discussing the need to initiate a campaign to advocate for Sudanese needs. Since then, we took this discussion seriously, and Infinite has been planned and launched this 3 months campaign with support of many partners and experts. Simply, this forum is the first milestone of the campaign. This is not the end. It's only the start and the first milestone. It aims to highlight Sudan's health and humanitarian needs, advocate for support for Sudan, and foster stakeholder collaboration and coordination. For today, I am honored and I will host this forum alongside with my colleague, Dr. Haytham Bashir, the Director of Infinite Public Health Emergency Management Center based in Amman, Jordan, to set the sense for our discussion. Dr. Bashir will explain the Sudan Support Campaign initiative. So if you allow me, Dr. Haytham, the floor is yours, and you have 15 minutes to present these initiatives for our colleagues. Thank you. The floor is yours.
Thank you, Dr. Muhannad, and welcome all. It is a real pleasure being with you again. Seeing all those giant names and experts, I promise to limit my talk to give the opportunity for our experts to to share their insights and reflections as well. So um, uh, now, as Dr. Mohammed mentioned, this is the first milestone of our 3-month campaign to support the health sector in Sudan. And we have been in continuous communication and coordination with our partners, of course, including the Ministry of Health, since the start of the conflict, April last year. And also based on various sources and based also on our visit, we realized how tragic the situation is in Sudan. It's not only the violence, but unfortunately, in the last, at least in the last few months, we have witnessed epidemics. Just the Minister of Health declared the cholera outbreak in the country. This week, last week, we have witnessed devastating floods, especially in the east and north Sudan. The violence continues. Millions displaced inside and outside the country. The figures and indicators on malnutrition are really terrifying, not to mention the loss of the essential services, including health care, infrastructure, the power, communication, and not to forget the huge burden of stress that are all our shoulders since this, the eruption of this conflict. And when our colleagues in the technical working groups had their brainstorming, they could categorize the unmet needs mainly around human resources, services including primary and secondary health care, insufficient medical and supplies and equipment, and all the essential humanitarian needs. Drink, safe water, food, shelter, etc. Many other needs are lost. So why those needs remain unmet? This is a question that has been circulating since the beginning of this crisis, together with a question on why the case of Sudan has this such low profile among the international community partners, media, and others. So some of the reasons is, of course, straightforward access. Many areas are not accessible either due to security or other reasons. Of course, there is huge gap between the available resources and the needs. And in responding to why we have this such low profile, despite being one of the largest crises nowadays worldwide, some may consider that many of the partners, workers, agencies are not really understand or having the actual scale of the crisis in Sudan. Some may be simply not interested due to many reasons. Others, when they were asked, maybe their resources are shifted to other priority regions for them. And some of them, when I personally talk to many of our partners, they simply don't know how to support, how to contribute, how to access. This is why we plan after this forum, we are going to share a survey among the donors and partners, just to trying to answer those questions and see why. So, however, MFNET definitely is not one of those who are not interested. We have been there in the country. We try to do our best with whatever resources we have. Our support range from assigning experts in country supporting the rapid response teams. And despite the war, we could train and graduate actually a cohort of 30 field epidemiologists to support the health system in the country. With our partners in Gavi, also we could build the capacity of EPI officers in the country. Our project on community-based surveillance for special populations, the displaced, the refugees, is ongoing. And we could mobilize some supplies and consumables for the public health lab. Our efforts also continue to highlight the case of Sudan, and we published 20 issues of our biweekly bulletin, mainly to highlight the issues. And we were privileged to have more like 16 distinguished speakers in our previous webinars. They discussed the issue of Sudan and also shared valuable recommendations and solutions. So we, based on those facts, we have developed an infinite plan to support Sudan, mainly to build the capacity to respond to public health emergency. And this campaign is actually one component of our plan to advocate for the Sudan case. So the campaign is simply tries to highlight the urgent health needs and impact of the conflict, mobilize more resources, and foster collaboration among stakeholders. And starting July 11, we have formulated a preparatory committee of 14 Sudanese and non-Sudanese experts and professionals distributed over 3 technical working groups. Group 1 to mainly discuss the short-term health priorities, the second group, the long-term health system strengthening, and the third group is for advocacy and resource mobilization, with over 30 volunteered experts and health professionals who have contributed to the development of project-based recommendations, as I will show you in a meeting. So based on the specified priorities, responding to disease outbreaks, meet the needs of the displaced and refugee populations, establish and maintain the point of health care, and in the short term is to support the rural health centers, specialized treatment centers for the renal dialysis, cardiac care, cancer, and other critical cases, medications and so on for the NCDs, and of course the maternal and child health care. So for our experts also recommended to think now about the future and how to build back better the health system after or post-conflict. Simply following the pillars of the health system and recommend sustained interventions and solutions. So up to date, we have received and structured 34 projects with clear objectives and outcomes, covering the 3 areas: the immediate, the short, and the long-term interventions and priorities. So this is the timeline for our campaign that started July 11th. Then just yesterday, we received the last package of projects. And this is the first forum in this campaign. Our next step will be to add and finalize the projects that have been developed by the experts, and we will run stakeholders analysis to match those projects to interested donors and partners. I will talk also about the campaign dashboard, where we will post the abstracts of those projects and make them accessible. Then we plan, inshallah, in September 17th, as part of our Infinite Regional Conference to have another in-person forum. And then kindly, Dr. Mohammed just approved that we will go beyond the 3-month campaign and it will be extended beyond September. So through this campaign, we are trying to, as I said, raise the awareness, figure out how to mobilize more resources, but importantly is to coordinate the efforts and contribution of all partners who are interested in supporting Sudan, simply to avoid duplication and avoid missing any of the mentioned areas. We believe that this campaign will increase the collaboration among partners for the greater impact as an outcome of this collective effort. And for me, I think this is a golden opportunity. Having those over 40 beautiful minds and experts, they can serve as a pool of experts and advisors to the health system in Sudan. Not only during the conflict, but I'm sure all of them are interested to continue their support post-conflict. An important point that I would like to stress on is that this campaign is not about pooling of resources. So each and every agency, partner, donor, they have the right to manage their resources the way they see. But at least this campaign will provide the opportunity for us all to see who is doing what and where. And for the dashboard, as I mentioned, all projects will be, or the abstracts will be posted on the campaign dashboard. Experts and agencies can upload their projects and initiatives, of course, after being reviewed by our panel of experts. And then also in that dashboard, partners will have access to the projects of their interest to see what they can do. This dashboard will provide a platform for all partners and experts to engage into interactive discussions. You may find donors, implementers, collaborators, advisors, subject matter experts, etc. And finally, this platform will show the progress and contribution of all partners. Of course, it is voluntary to report your progress, but it can be an opportunity also to show your contribution. So with this, I will stop here, and I'm sure that we all agree with me that when people are in need, we strive for no excuses. Thank you, Subhanad, and back to you.
Thank you.
Sorry. Thank you very much, Dr. Bashir, for this comprehensive overview of the campaign. Maybe you were very nice and delicate by using low-profile emergency. I think we have read in the past few months and maybe 1 year that the current conflict in Sudan, it's a missed emergency or forgotten emergency from the international community at the regional and the global community. We have to address that the current situation in Sudan needs more support and needs more attention from all of us in the globe and those who are working in the area of public health. Especially with the complexity of Sudan, the size of the country, one of the biggest country in the region, and with the nature of the countries, with the borders with other countries like AIDS, to best of my knowledge, AIDS countries with the borders, etc. So if we look technically speaking, we see that there is ignorance and sometimes it goes to be forgotten emergency, as I like to call. We expect this campaign to contribute and to complement other initiatives. And we are saying here, as Dr. Haytham said, it's not infinite only. It's just we are trying to bring the attention and coordinate the current efforts and to make sure people are linked to each other. And this is one of the mandate of Infinite by networking, coordination, and improve and enhance communication to address one of our time's most urgent humanitarian crises, maybe not only in the region, but even at the global level. With this, allow me, I am very pleased and honored to introduce our first speaker for today, His Excellency Dr. Haytham Awadallah, the Federal Minister of Health of Sudan. Dr. Awadallah has been leading the ministry since 2021 and brings a wealth of expertise in healthcare system management and policy formulation. Dr. Awadallah, as Sudan continues to navigate the profound challenges of the ongoing conflict, we are really here eager to hear from you or your perspective on the humanitarian crisis and the current state of the health in the country as a whole. So, Your Excellency, the floor is yours, and we are looking forward to hear from you. Please.
السلام عليكم ورحمة الله وبركاته. Thank you very much, Dr. Muhammad. Thank you very much, Dr. Haitham and Infinite team. Really, I'm very glad that the idea we have discussed in the World Health Assembly now become real, and we have kicked off this campaign. Assalamu alaikum, all distinguished guests and experts, and also as his ambassador of Sudan in Jordan. Thank you very much for coming today, and also this, I think, a very supportive start from all I have seen attending this meeting or symposium, over 200. Thank you very much, Dr. Muhammad, and thank you very much for the working group and the teams preparing for this. Let me start by this photo describing the commitment of the health workforce in the country. Really, we are in crisis now, but we are looking ahead for the opportunities to save the lives of the people of Sudan, and to strengthen and to rehabilitate the health system in the country. This picture of this frontliner staff showing the commitment of our staff towards their people in the country, and also it is an example bringing hope to the health system and to the people of Sudan. I'm not sure if the slide is moving.
Dr. Haytham, if you can put in the presentation mode, yes, thank you.
Okay.
I think we lost.
Right.
Dr. Haytham, we cannot hear you.
due to connectivity issues, but His Excellency is joining, Dr. Muhammad. Just
Okay, okay.
beg your pardon. Yes.
I understand that when the internet sometimes the issue.
Yes, we'll try to work it out. Wait.
Yes, we are. We have Dr. His Excellency with us, Mas. Please, Dr. Haytham, we are. Yes.
Sorry, today a little bit the internet was not.
Since we are talking about a little bit, we can know where it is. We can wait, we can hear. It's very good to hear from you. Thank you very much. We can see your slide, please.
Again, problem.
We have a problem with His Excellency Dr. Haytham, and maybe I can tell you, just until getting Dr. Haytham back, it was really very fruitful to meet His Excellency during the World Health Assembly last time in Geneva, and when we start in depth, discussing this idea, it was very difficult to get it on the ground. But gradually, with the efforts of all colleagues and with different experts, it really was very important milestone to meet with His Excellency and his team and to crystallize this idea in more practical approach and how we can make sure of the continuation of this initiatives and to make sure to get Sudanese people more benefit from such initiatives. Dr. Haytham, Dr. Haytham,
Yeah.
if after getting His
Yes.
Excellency back, I think we have also with us His Excellency the ambassador, maybe Hassan Siwar Dahab, if he would like to hear from him and to see how his vision about this matter. Thank you.
Dr. Hassan back.
Okay.
Dr. Haytham, I will share your slides from my side, okay?
Okay.
Okay. Excellent. Good.
You know that we are using 3 different SIM card to ensure good access today, but unfortunately today the internet was a little bit bad. Okay, next slide, Dr. Haytham.
Mhm.
Next one, Dr. Haytham. Next slide, Dr. Haytham. Okay, thank you very much. I do apologize for that, but this is a part of our daily challenges. We are facing such challenges in communication with the states, in receiving health information from the states. But we used to deal with that. I mentioned that now it is like, attracted, sorry?
Yes, we can hear you, Dr. Haytham.
Okay, thank you very much, Dr. Haytham. Sorry for that. And now, as if the country, the challenges become like that, as if the country now is becoming like two parts. This part is now controlled mostly by RSF. It's hard to reach area, inaccessible, insecurity, difficult access, low level of information from this area. On the other hand, the area controlled by ISAF, you know that there is overburden for the health system, exhaustion of the healthcare facilities, IDDs influx in high number, require humanitarian need, and the emerging of outbreaks in this area we have seen. That means we are dealing with different current challenges in terms of movement of the population, in terms of humanitarian needs, in terms of insecurity, in terms of accessibility to health services. And just here I summarize the key areas in the health system and the situation in the health system, starting from the first pillar in our planet, ensuring medicines and supplies that essential for the lives of the people. The monthly need expected for the country is like 50 million US dollar. And now really just we are focusing on to provide the essential life-saving medicines, not more than 700 items out of more than 3,000 items. And it is difficult to talk about the availability of medicines in the country now. We are usually talking with ensuring at least 1 or 2 months available life-saving medicines, ranging from 0 to 60% all the time. And also it is that all in-country production and factories are out of services. Most of them are in Khartoum or outside. If we come to the financing of the healthcare system, the annual budget for the Ministry of Health in 2023, it is $1.4 billion US per year. That means I need 100 million every month. Today, during this year of war, not more than 40% covered of these expenses. And the coverage not only from, yes, the country is contributing, but also the maximum coming from, unfortunately, from the out-of-pocket, despite the crisis, from out-of-pocket of the patients. And what is coming from external support is actually negligible to support the healthcare services. In terms of health workforce, these are the real assets of the country, making the difference and preserving the resilience of the health system now. But they are facing challenges, and the big challenges are facing by the
Seems that we also lost the connection with Sudan.
Yeah, you know, I was saying that since we have His Excellency Suar Dahab with us, maybe, and as I said, you know, in my introductory that we had this initial discussion during our visit to his office. So maybe until getting Dr. Haytham back with us, you know, we can, you know, to listen to His Excellency for a few minutes, if he does not mind.
Thank you, Dr. Mohanad, and all the participants. And I have to say, Bismillah ar-Rahman ar-Rahim, Your Excellency, Dr. Haitham Abdullah, Acting Federal Minister of Health. Ladies and gentlemen, esteemed representatives from various international and regional institutions and organizations. Good evening. I'm honored and delighted to address you today as the Sudanese ambassador to the Hashemite Kingdom of Jordan in this forum, which started as an initiative of the Sudanese embassy in Amman and has come to light with your cooperation and support. As you know, the health sector in Sudan is under severe strain due to ongoing conflict. Your presence here today reflects the vital international solidarity needed to address the urgent challenges. Ladies and gentlemen, diplomacy plays a crucial role coordinating effort to alleviate suffering and support those affected by conflict. Our course is now on ensuring access to essential medicine, vaccines, and medical equipment for those in their needs, as well as raising awareness and encouraging policies that support public health. We aim to combat disease and to foster cooperation and negotiate agreements that ensure effective and impactful outcomes. I'd like to assure you that you are committed to facilitating your support by simplifying visa procedure and providing direct communication channels to ensure swift and effective interaction. Our embassies are here to assist with any question or needs you may have. In closing, I'd like to express my deepest gratitude to all our partners and supporters. Special thanks to His Excellency Dr. Firas Al-Hawari, Jordanian Minister of Health, and Dr. Muhammad Al-Mansour, Executive Director of Infinite, for their continuous support. Thank you for your trust and dedication. Let us continue working together for a healthier Sudan and brighter future for all. Thank you very much.
Thank you very much, Your Excellency. So, do we have Dr. Haitham with us, or we still
On and off.
on and off? Maybe we
Yeah.
can, we can move Dr. Haitham, and then whenever His Excellency will be available, then we can give him the floor. So please to proceed, Dr. Haitham, please.
Thank you all. So as we are discussing the role of partners in supporting Sudan, this evening we have with us Dr. Ala. Dr. Ala Mudathir is the Director of the International Health Department at the Ministry of Health. And she is going to share with us what is the situation there in Sudan, particularly when it comes to the role of partners and the their contribution in supporting the health sector in Sudan. So please, Dr. Ala, the floor is yours.
Well, thank you very much. Can you confirm that you can hear me? Thank you. Thank you very much, Infinite, for sponsoring this campaign for Sudan. I think the situation actually is really necessitate such collaborative approach in action, given all the challenges that's ongoing, the competing priorities all over the region, and many obstacles that is faced by the country, and may peace prevail soon. Allow me to share my screen. Will be presenting, and then maybe His Excellency, after the network will would improve, then he might join us for a kind of during the closing remarks for a wrap up. Well, I'll be presenting health and humanitarian needs and priority interventions in Sudan. And as Dr. Haitham stated, that I will be shedding some light on the current situation in the country. The presentation outlines, we will have an overview of the conflict and floods impact on health situation in Sudan, humanitarian needs and gaps. We might also come across the kind of balanced mix between humanitarian versus developmental interventions, how we can be more focus in response and responding to the emergency, while we put in mind the developmental aspects of these interventions. I'll be shedding some light as well on the top 5 priorities of health needs and related costs that have been already developed by Federal Ministry of Health. And then we will talk about international aid and coordination. What are the limitations, challenges, opportunities, and the way forward? So the impact of war on health system in Sudan, actually, after 1 year and after more than 1 year and 4 months, actually, of armed conflict, there has been a devastating public health and socioeconomic consequences of such conflict, resulting in one of the worst humanitarian crises in history. Healthcare facilities compromised, and there has been a destruction of health infrastructure, all referral and specialized hospitals in Khartoum and Al Jazeera, the National Public Health Lab, and the Federal Central Blood Bank were out of service. Then, indeed, due to such huge burden for the health system, there has been an exodus of health workers, escalating violence, increasing the trend and the level of health attack on healthcare providers, where we have, like, for instance, those only who are officially reported, there has been more than 50 healthcare providers were actually killed. And then, indeed, the financial losses, the looting, and the destruction, it was quite you can feel that it's an intentional destruction of the infrastructure, health system infrastructure, where we have the financial losses actually were estimated to be more than $11 billion. And that actually impacted the already underfunded sector. And then just to take you as well for another dimension that really we all need to pay attention to, is the consequence and the impact of the climate change and its manifestations on worsening the health status in Sudan. So an estimated of 317,000 people, actually 56,450 families have been affected by heavy rains and flooding in 60 localities across the 16 states in Sudan since the onset of rain in June 2024. And indeed, these huge displacement had actually occurred where 27,000 houses has been damaged, and currently 80%, due to the war and floods, actually more than 80% of health facilities are non-functioning. This has limited the accessibility to essential medicines and emergency health service. Well, the humanitarian needs and gaps, humanitarian versus developmental. Humanitarian needs and response plan has been actually developed and published on February 7th, 2024. And then it was actually, the objective of this plan was to address the needs of women, children, and vulnerable population. The target actually were for 14.7 million vulnerable people, and the funding required was $2.4 billion, and the current available funding actually, or the already secured funding, was less than 1 billion. The needs for health sector are linked to 5 priorities that Federal Ministry of Health adopted, budgeted at a kind of intermediate stage after the war, because as we all know that for the health system recovery after a crisis, we go through 3 stages. First of all, we go through the response stage, and then we go for early recovery, decentralization and early recovery, and then later we go for sustainable and developmental aspects of these. These 3 stages cannot be clear. You cannot demark a kind of clear cut of these stages. So we have been trying to wisely design and interventions and our priorities to fit for purpose for humanitarian response, what we need for now, but without forgetting about the future and the needs for more sustainability for the already deteriorated health system. The needs are designed and will be even more designed. Thanks, Dr. Haytham, for bringing for orienting actually the audience about the campaign. Actually, when we drafted the concept note, we were quite sure that we will be at the right hand of MFNET to ensure the right people, the right experts are in the table to discuss and come with a more updated and practical ways to ensure that the 5 priorities of the Federal Ministry of Health are aligned with a more evidence-based approach and more systematic thinking approach. So the needs will be designed in a more updated where experts around the table and will be time-bound in a more practical way into short-term, as Dr. Haytham Bashir was illustrating, as short-term and intermediate as well as long-term interventions. The top 5 priorities for health sector during 2024, actually, the first one is considering with the supply chain, ensuring that we supply the life-saving medications, the consumables to the right beneficiaries in the right time with the right quality as much as possible. And indeed, approximate cost. I will just give you a brief about how we calculated the approximate cost, because the losses were huge. Actually, the supply chain sector encountered the great loss when the National Medicine Supplies Fund central premises where we have the central stock were looted, and then we couldn't access it anymore. These actually overburden the health system with a more need for more supplies and commodities to be in a place where we can access, we can distribute to the beneficiaries. So supplies of essential and life-saving medicines, and then ensuring the continuity of services, emergency basic health services through hospitals and health institutions, then enabling the health system to control epidemics and outbreaks, to reduce mortalities and morbidities, ensuring the continuity of maternal and child health programs. And indeed, the 5th priority is commanding coordinated response within UN agencies, international NGOs, as well as all health sector partners and international donors. These are approximate cost. Each priority, actually, we had our own projects for each priority, and even the projects were segmented according to the 3 stages of health system recovery. So we have our own projects for the response phase, And then we have our own projects as well to respond to the stage of decentralization and early recovery, and for the sustainable and developmental stage as well. First of all, the priority, as I already stated, that the National Medical Supply Fund actually warehouses, which has been occupied and looted by the RSF, with total estimated amount lost exceeds 500 million USD. And then, but with effort, with the dedication of all healthcare workforce who are involved with the health sector and supply chain management, to date, NMSF, and with great recognition for the donors, we have received and distributed 4,812 tons of medicines and medical supplies from 27 donors, including NGOs, UN organizations, bilateral support from several countries. And we do have all the records for that. The photo actually is referring to the airdropping intervention that have been recently carried out by NMSF and other internal with internal coordination. It's all governmental effort to airdrop supplies to Al-Fashir. And indeed, this month, actually, we have celebrated the launching of the National Humanitarian Response Reform and Recovery Supply Chain Strategy for Pharmaceuticals and Health Products for 2024 and 2028. The NMSF has also implemented airdropping supply methods to deliver medicines to North Darfur, including, like, as I said, it's 30 tons of medicines, including malaria, tuberculosis, AIDS treatment, as well as some cancer drugs and other life-saving commodities. The challenges and gaps, there is a reduced availability of supplies, medicines, and technologies due to the loss of the main house, loss of the local manufacturers as well, which creates an importation dependence status, with difficulties of shipping complications and local currency and inflation. So economic prices as well is spelling over creating more barriers over the supplies availability in country. There is a reduced accessibility, challenging transportation of medicines and supplies to all states and localities. The National Medicines and Poison Board, this is the Quality Regulatory Authority, the General Directorate of Pharmacy, which govern the overall practice of pharmacy, and the governmental supported medicines is called free medicines. And both are very important in ensuring health, efficient health commodity supply chain management. These for $600 million. For the emergency surveillance, preparedness, and response, actually, I am very thrilled to inform you that despite all the challenges, despite all the very challenging operating environment that we are embedded in, the reporting rates, with the dedication of the staff and their commitment to reporting, the reporting rates actually increased from 16% since May 2023, after the crisis. Now it's 65 in August 2024. And then, of course, the electronic early warning alert and response system, EWARS, implemented in 10 accessible states. This has been with the general support of WHO. The National Surveillance Dashboard, this is a very important and a great step forward towards health, more informed decision-making. We have launched to ensure timely information sharing for humanitarian response, the ongoing needs to ensure reliability and sustainability. I will show you in the next slide yes, maybe the one after it. The Health Emergencies and Epidemic Control General Directorate actually managed to prepare a multi-hazard plan to address health emergencies up to 2025. The plan actually cost $29,520,602 USD, and then along with the supplies that are cost costing 13,485,143 USD, and the total would be 43 million and 5,745 USD. Indeed, with the ongoing crisis, the flood and the displacement, and with the poor infrastructure, and with the very paralyzed, if we can give it this way, paralyzed and limited vector control, vector control management and interventions, we were expecting as usual, and the cholera outbreak just after the rainy season. And unfortunately, this month, His Excellency actually declared that there has been a confirmed cholera cases in the country. So the emergency department actually created and reactivated the cholera response plan as one of the major biological hazards that's developed in with many pillars are just waiting for support. These are almost costing $15 million for the next 4 months. These actually is the most updated. Let me get to it. This I actually extracted it from the National Surveillance dashboard proudly, and we have the ongoing outbreaks. You can check it. You can log there. It's an interactive platform that you can go and check and see the updates regularly. The surveillance team are really doing great job in updating all the information, making it accessible to all partners and donors. So indeed, the ongoing outbreaks as of 27th of August, we have measles, cholera, dengue fever, malaria, and meningitis. Then indeed, the bulk of the activities and the main focus were in ensuring continuity of service and the basic emergency health services, with the focus on maternal and child health. Maternal and child health, just like others as well, went very well with good coverage in safer states. However, until now, they are trying to exercise different modalities to ensure national coverage. And despite of these challenges, actually, the MMR in a single dose campaign was successfully introduced to the country. This is the first round, and now the second round is already launched this week, with achieving more than 90% coverage. So Sudan is one of the countries shouldering high burden, since even before the war, even with all the complications before the war. Actually, we do have a high burden of malnutrition. It's estimated that 1/3 of the children have stunted growth, severe acute malnutrition, and some prevalence is around 15%, and some is around 7%. This is getting worse after this war and displacement due to the recent floods.
If you can conclude in 2 minutes.
Yes, I will. So more focus is needed to sexual and reproductive health, prevention and control of communicable and non-communicable diseases, mental health, and psychosocial support. The health workforce as a backbone of the crisis response, over 50 healthcare workers, as I mentioned. And then there has been already a pre-war challenges, massive migration of health workers, inequitable distribution within the country, poor working conditions and low remuneration, and the war impacted in many health workers, internally displaced, became refugees or migrated abroad. Sudanese health workforce actually, despite threats, they showed commitment and dedication. The urgent priorities, we need to design and implement policies to attract and retain qualified health workers, leverage the competent Sudanese diaspora to build innovative and win-win partnership with host countries. Commanded, coordinated response agencies. We recognize the contribution of international donors, all the support that have been provided by bilateral support and local effort as well. Health cluster actually plays a crucial role in coordinating humanitarian response. Also, the non-health cluster members, I'm talking about Médecins Sans Frontières, ICCRC, and others, we coordinate with them directly through Federal Ministry of Health, try to facilitate whatever challenges they face, and several coordination meetings were held to ensure facilitation of the challenges. A significant gap between the country's need and the provided assistance. I think Dr. Haytham already flagged the issue of why donors are not, why there is a gap between the needs and the available resources. We have already discussed this several times, and we have disseminate the donors responses into 3 categories that have already been shared by Dr. Haytham Bashir. And then this is actually from the health cluster. This is the operational presence of our partners in the ground. And we appreciate all of their support and recognize all the effort. Well, the limitations might also include security, accessibility, outbreaks, financing, governance, and leadership. I will be mainly talking about the opportunities. Of course, for the security, we hope peace prevail to the country soon. There is an effort for a discussion on humanitarian corridors opening. And then currently there is 2 corridors are now agreed to be opened, Adri and Dabba. And then indeed there has been more cross-border and cross-lines agreement for facilitation of transportation of commodities. For the preparedness and outbreaks, we already, I think it's a good opportunity that the surveillance system is functional, and we need to make sure that we are for a more evidence-based approach in planning, and this is already the way forward. We do have plans that are ready and just waiting to be supported and pledged. For the financing, government contribution and commitment continued despite of the economic difficulties, and with the leadership and flexibilities by Federal Ministry of Health, we will ensure financial management and assurance provision. Then strategic direction, clarity despite the ongoing crisis, coordination and collaboration with partners, efficient responses to challenges as communicated by partners. Thank you, and I'll be very happy to respond to any query from your end.
Thank you. Thank you, Dr. Ala. And I think now we have a better idea about the role of partners on the ground. And as we have been listening to the voice of the Ministry of Health, I think now it is time to listen to the other side of the story. We have this evening a very special guest, Dr. Yasir. I just knew him a few days ago, and he's maybe we missed seeing each other for a long time. But Dr. Yasir Al-Amin, he is the president of the Sudanese American Physician Association, SAPA. He is has been leading the SAPA based on the US, but their humanitarian work and contribution covered Sudan, Chad, Uganda, and the United States. Since the onset of the conflict, Dr. Yasir visited the country twice to better understand the situation on the ground. So, Dr. Yasir, without any further ado, please share with us your perception and what do you think about the ongoing conflict and the health consequences and your experience as SAPA and Yasir. Please.
Thank you very much, Dr. Haytham, His Excellency, Dr. Haytham Awadallah, Dr. Nusur, esteemed colleagues and friends. I'm very glad here to be with you and grateful to the opportunity to be able to speak to you a little bit about the role of civil society in supporting healthcare in Sudan. I need to start by disclosing that, unlike most of you, I'm not a public healthcare expert, but I'm trying to speak on behalf of my colleagues in Sudan and other countries who are doing this great work. So here is an overview of my slides. I'm going to provide a quick introduction on Sudan context. I'll speak on the civil society organization's role. I'll use SAPA's efforts as a case study to show our impact. And also I'll talk about challenges facing civil society organizations and diaspora. And I'll close up with some future directions. So we've heard the numbers, 10 million internally displaced, 2 million refugees. I don't want to spend too long time talking about this. We all know the numbers. Around 43% of healthcare facilities are out of service, according to the WHO. But what really matters here is that these numbers are real people. And these places that has been destroyed are places that we're all worked in, we all know very well. Last month when I was in Sudan, I visited one of the maternity hospitals in Durman, and I took these photos with my phone. You could see the complete destruction of the hospital, which was serving a catchment area close to 1 million people. Air conditioning have been removed from the hospital building. All the equipment have been looted. The level of destruction is unbelievable and unprecedented. Not that only, but the human impact was also severe. I visited a pediatric hospital that we support, and I met this young boy, Qais. This is how he looked. This is at the heart of our capital, Durman and Khartoum. So this is kind of, these numbers translate into real humans, as you all know. Now, just a quick background. I want to say that Sudan historically had a very vibrant civil society. All Sudanese in this call are probably members of associations and unions, including the minister himself, probably. And the civil society in Sudan has been contributing in so many ways to public life in Sudan. In terms of diaspora, it's important to note that at least one of every 3 Sudanese graduates leave the country, and that was even before the war. So the Sudanese diaspora by nature are well educated, and that translates into their ability to play a role in knowledge transfer and also in the ability in supporting the country financially. It's estimated that Sudanese diaspora have contributed around $1.5 billion in 2022, and I do believe that this number is probably an underestimation. Since the war erupted, civil society organizations have been playing a critical role in delivering health services, particularly in underserved area and other conflict-affected areas. They also played a role in supporting primary healthcare facilities across Sudan. It's very usual to see people who come from the same town or village in Sudan collecting money to support the primary health care from the place that they came from. They also play a critical role in capacity building by training local healthcare workers and enhancing emergency response capabilities. In addition to that, Sudanese diaspora provides significant financial support to health initiatives in Sudan, and they contribute also to knowledge transfer, and also they play a very important role in advocacy efforts to raise global awareness and secure international support for Sudan's health sector. I'll take you quickly through our experience working in Sudan since the war erupted. Our organization was established in the United States in 2019. Now we are registered as a humanitarian organizations in the US, Sudan, Uganda, and Chad, with offices in all these 4 countries. We take our openness and accountability seriously. We do hold the Platinum Seal of Transparency. This is a measure of a US-based organization transparency, and we're proud to say that we are among the top 0.1% charities in the United States when it comes to this measure of transparency. Since the war erupted, our organization probably received the highest amount of individual donations from tens of thousands of donors across the world who trusted our organization. I always say that I went to medical school in Sudan. Our entire board has have gone to medical school in Sudan. So we have deep ties to local communities in Sudan. We view ourselves as a grassroots organization. Our work does not depend only on individual donors, but we work closely with multiple partners, including a very strong partnership with the Federal Ministry of Health. We also work with other UN agencies. Some of these UN agencies were actually their largest partner across Sudan. And we also work proudly with multiple local Sudanese organizations in food sectors, including ones like Sadaqat al-Hadirin and so on. This is our presence now. While we operate in almost 9 states, we have offices in 7 states, including, difficult to reach states that are controlled by the RSF, like South Darfur, North Darfur. We're also present in South Kordofan, and of course in Khartoum state and in other states as well. Our programs run from direct health services provision to health system resiliency and to WASH programs, food and nutrition, and also protection. When it comes to direct health services, we tend to deploy mobile clinics in all the states that we work in. We do have also primary healthcare centers that we run in multiple states. We're now operating in difficult areas to reach. For example, in North Darfur, we're present in Al-Ayat, in Tawila, in Saraf Umrah. We're also working in Al-Fashir. Our program aims to reach, as I said, remote and underserved areas, as well as the continuous provision of critical healthcare services through hospitals. And here I want to really acknowledge and recognize all the support that we got from different UN agencies to complete this work. In terms of trying to support the national health system, as I said earlier, we work closely with the Federal Ministry of Health. We work also with the local ministries of health in supporting their infrastructure. And we try to do things that can really contribute to the health system in Sudan. A recent example, we're working with the Ministry of Health in Red Sea to operate the pediatric ICU in the teaching hospital there. Once it's open in the next few days, it's going to be the largest pediatric ICU in Sudan. We're providing the entire operational cost for 6 months, and hopefully we will be able to expand beyond that. We're equally, for example, working with the Ministry of Health in South Kordofan, where we provide full funding to run the emergency room in the Abu Jbeha Hospital. And the examples are multiple in this context. We also try to work on developmental projects. For instance, we provided Medani Hospital with 2 operating rooms and so on. We also had, especially in the earlier days of war, an active program of WASH that we're trying to keep up now and expand on, especially given the recent flooding. In terms of food and nutrition, this is something that we work with partners and also try to implement ourselves when it comes to nutritional services, using ready-to-use therapeutics foods and so on. We work on this program as well, closely with the UNICEF. We had a very strong child protection program in Medani. Of course, that was shut down after it was taken over by the RSF. But wherever we work, we try to create these child-friendly spaces that provide psychological support programs. We're going to be soon launching one in our center in Zamzam camp, where we're hoping that it's going to be a model that can be replicated in other places as well. This is kind of a summary of our achievement in the past year or longer. We've been able to reach, despite all these difficulties, more than 400,000 patients. We've supported more than 20 hospitals and healthcare centers across the country. We have been in 9 states. We've brought tens of tons of medical supplies to the country. We work very closely, as I said, with the local authorities in making sure that our colleagues, healthcare professionals, stay in Sudan. And to do so, we try to provide incentives. We provided incentives to more than 3,000 healthcare professionals. We also make sure that there is a kind of a pathway to career progress. So we've worked with Sudan Medical Council very closely in digitalizing their work. That has helped tens of thousands of our colleagues to be able to get their certificates. As I was saying earlier, we've also worked in some developmental projects. We've established 2 oxygen stations, one of them in Sinja and the other in Niala. This is kind of a snapshot of the data that we're trying to collect. This is from our recent readings from Khartoum State, Northern State, Red State, and South Kordofan. We take this very seriously. We try to mine it. We try to see what lessons we can learn from. We've already started a significant effort to publish some of this data. We've already done 1 publication, and the second is under review. And again, we're trying here really to share the lessons that we have learned from our experience in terms of trades, practices under extreme shortages of resources, and so on. Another snapshot of the data that we collect and that has some of the impact that we have done. So this is strategies that have been guiding our work, and we're trying to implement in our work in the next 2 years or so. I'll go through them very quickly. We focus on cross-sectional and life cycle evidence generation. We really invest in grassroots organizations. We work very hard to ensure community empowerment and accountability to affected population, and we do our best to be gender responsive. And again, we work very hard on establishing partnerships. We also try to be innovative, and I think an example of this is what we have done in our mechanism to really seek new innovative ways of fundraising. As I said, we have a large donor base now that extend across all continents. We use very sophisticated tools to be able to achieve that. We'll also try to be crisis responsive, and also try to be agile in our deployment of teams in emergencies. Now we have at least 4 teams that have been deployed in 4 localities in Northern State in response to the floodings there. We're trying to do the same, inshallah, in Red Sea as well. We use flexible financing, and we also have a very strong evidence-based advocacy. So what challenges that are facing us and other community, civil society organization? Access continues to be an issue. Security really continues to be a major issue to reach all areas that in need. Funding constraints have been an issue because that stop you from really scaling up your intervention. I believe that there is a need for better coordination among us, civil society organizations and government agencies. Often when I'm asked what is the single challenge that is fixable, I say it's coordination. I think coordination is fixable, and it's really a big challenge. So in terms of future directions, as I said, we're working very hard to strengthen our coordination with community and with civic service in Sudan. Sudan is obviously a third world country, so we do have issues around incompetence, corruption. But despite all of that, I believe that there is a viable and strong civic service in Sudan. All the tens of thousands of civil servants in Sudan are doing a fantastic job. We work very closely with healthcare authorities. And here I really want to recognize and acknowledge the work that the Federal Ministry of Health has been doing. I want to say that as a Sudanese, I'm proud and inspired of the work that they have been doing. And I think one day all of us will be able to sit and say that their efforts really kept the health system in Sudan together. We want to also invest in sustainable health infrastructure and services that can withstand conflict and economic instability. We're also hoping to be able to enhance diaspora engagement and knowledge transfer, despite the difficulty in internet connection, as we just witnessed firsthand. And we want to strengthen our advocacy efforts to build global partnerships and secure international support. And as both Dr. Haytham, the ministry, and Dr. Haytham Bashir said, it's important to think of the day after, because the war will end, and inshallah will end soon. In conclusion, civil society organizations and the Sudanese diaspora play a critical role in supporting Sudan health sector. Our own experience demonstrate the impact of these contributions despite significant challenges. Continued investment, collaboration, and innovations are essential for improving health outcomes in Sudan. I want to wrap up by showing you the photo of Qais 1 month later after he was treated in a stabilization center. He's now a little bit more grumpy, but certainly more healthy. With that, I thank you for your support, and I look forward to continued collaboration. Thank you very much.
Amazing, amazing. Thank you, Dr. Yasir. And I think what you have been doing is really inspiring. And just to prove that despite the challenging condition, still we can do something. And welcome back, Dr. Haytham. We have, as you may see, a group of experts. Dr. Haytham, if you would like to listen to their comments, advices, and then you can respond, that's okay. So please, distinguished guests, feel free to raise your hand if you have any comments or reflection on what has been presented. Okay. Ladies first, Dr. Amuna, please.
Thank you very much. No, I absolutely appreciate all the effort that's gone into organizing the campaign and, the very specific projects and priorities that have emerged, particularly informed by Federal Ministry of Health Information and Data. So my name is Muna Abdulaziz, and I'm a Director of Public Health in the UK. I'm a member of the Sudan Special Interest Group. And we were working quite closely with Sudan during the pandemic, and I think some of my comments will reflect the way we worked during the pandemic and what was successful about that. So the diaspora are a strong asset for the country, and we're all looking for ways in which we can support. I remember during COVID, it was a same priority for all countries. So there was equitable distribution of resource, there was fair sharing of information across. And MFNET now has the opportunity to distill the lessons learned from other conflicts in the region and reflect on what works there. So during the pandemic, the diaspora were very influential, and I think that set up very strong contributions that we just heard laterally from Dr. Yasir around SAPA. The issue that we have is the diaspora don't know how to contribute beyond actual funding and financing some of the out-of-pocket expenditure of their families. So the list of priorities and programs, if there is a similar committee structure and a call for volunteers, then you would have specific volunteers who are interested in supporting some of these initiatives because they are coordinated initiatives. So just as an example, any group of experts who meet up will identify some ideas of what they would want to work on, but those are neither practical nor pragmatic, nor even affordable. The only way it can work is by that strength of the coordination of those programs so that we move from beyond the reporting and the needs assessments. Dr. Ala, you presented that very, very well. I think we should move on to the phases, the 3 phases that you spoke of, with a program approach. And at this time, the call is for volunteers, not for funding. So if we've identified the gaps in the stakeholders or the gaps in the experts that you need, all of the diaspora will be more than happy to contribute. So I think that is one point. We're also very good at advocacy. Sudan, the forgotten conflict. Sudan, the largest humanitarian crisis. We can advocate and people will listen. But without a specific ask or specific action, all you will get back are ideas and the offer of more money or offer of donations that will not help. So you have to develop those specific asks, not just on the volunteer side, but also on the program side. What are the equipment that are needed, etc. And so I think, moving on to the next step, I would suggest that we should have scenarios. Already we understand there are 3 phases. I'm personally connected to the MFNET post-conflict health system strengthening work, but who knows when that will come. So we should start working on that right now. And we should develop some scenarios and contingency plans if the conflict does not end in the next year, 2 years, 3 years, 5 years. So what are the contingencies? And we should practically start to plan because now we know what we're dealing with. I think in 2023, it was so volatile and complex, but now the data exists. And you will see in a lot of the comments that participants have put in, they are looking for this data and this information. So a way in which there is an official spokesperson that lets us know about updates on the programs and projects would be highly valuable. Thank you very much indeed.
Thank you, Dr. Muna. I think those are very practical advices, and I can see Professor Salman nodding his head in agreement with what you have mentioned. So, Professor Salman, if you would like to continue on this, or
yeah.
please.
Well, I agree with thank you very much indeed. Thank you for giving me the opportunity to contribute, and thank you for all the presenters despite the technical difficulties. I would like to raise two additional points actually here. And I'm really very, very impressed with the diaspora and press with the Sudanese colleagues from around the globe. This is the nature of our colleagues. This is not new. They are very nationalist in nature. They are Arabist in nature, and we are proud of them, to be very honest with you. And I did mention in our previous meetings that once the dust is settled, there will be no worries. The reaction will be fantastic. I have no doubt about it. I just want to raise a few points, and I don't want to say I delighted to upset people, but I will upset a few people, if you don't mind, Professor Mohammed. This is not a war, number one. I don't want you to call it a war between two countries, between multiple countries. This is a mutiny. This is not a civil war either, because this is a mutiny within the army, which is supposed to protect the people. And this is the tragedy. This is leading to a second concept, which I'm very, very uncomfortable about, my colleagues, that you are trying to accept the status quo. We should not accept the status quo, because people talking that this conflict, this mutiny, will continue for many years. It's already existed for too long. So our energy, our effort, I know the Federal Ministry of Health, many agencies, colleagues from United States, colleagues from Britain, Europe, etc., putting fantastic energy. But we need to remember sometime this energy is wasted because we are feeding this conflict. We are feeding this mutiny, we like it or not. I think one of our colleagues in the comments, I forget the name, and he's talking that sometimes donors at this stage are reluctant because of the lack of security. So again, the issues of the transparency, as you mentioned, of the corruption, then how I can encourage actually agencies to put more and more money, knowing that the people of Sudan themselves trying to accept the current situation when there are 10 million internally displaced people. 10 million. This is not a joke, This is actually bigger than the size of many, many European countries, including the one I'm sitting here in Cyprus, So we need to be very, very careful about what we are talking about. The other issue, which I like to say, that most of our work now in the various group which is set up by Infinite, which I'm really, really grateful for their fantastic work, for their leadership, for their clarity, for their directions, These working groups are looking at what will happen when there is stability. So I want my people, the people I love, I admire, my colleagues, our children in Sudan, our mothers and sisters, really to unite and to stop, let me call it, this madness. This is a madness happen in my Arab countries. And we should not actually endorse any party we should stop it, as we did in Yemen, as we did in Iraq, and in many other countries. This mutiny should be stopped, and the people on both sides, should be brought to justice, a justice that everyone in the Arab world should remember for the rest of their life. Thank you.
Thank you, Professor. And I'm not going in order of importance, of course, but may I call for Professor Ibrahim Bani?
Thank you, Dr. Haytham. And I would also like to thank Infinite, Professor Muhannad, for organizing this forum and starting this campaign. And really, it's great work, and Sudan's really in great need, because now Sudan is forgotten among this. So I think the campaign also should focus on international arm, how we can advocate with the international partners, how we can convince them to do more support, even helping with stopping what's going on in this war. We should come out also with a roadmap to take a step forward, starting with what's the immediate now humanitarian. Now, because still we are suffering, especially the health workforces, more than 50 have died. Security or protection should be a priority. And medical neutrality is very important in this aspect. And there should be training and raising awareness for the partners taking part in this, that protection, and also especially for the health facilities, for the patient, for the workforce, so that they can continue on. Another thing, we need to, the governments, to strengthen the collaboration with partners. This is very important, to identify who are the real partners who are really interested in working in Sudan, and then try to make very good coordination with them in an efficient way. I think the Ministry of Health and His Excellency the Minister, they are doing a great job. They are working in very, really, very poor situations, and they are doing really great job. I appreciate very much Dr. Haytham. He didn't leave the country since day one. He was inside the war. Then he moved to Port Sudan, and still there. We hear good success stories, sort of in spite of this humanitarian and disaster. So one of the recommendations that to have a roadmap to work on it. Thank you very much.
Thank you, Prof. Bani. And Dr. Majid?
Thank you very much, Dr. Haytham. Thank you very much, Dr. Muhannad, and thank you for His Excellency, Prof. Haytham and Dr. Ala, and all presenters for their great presentations, which shed the light on the current situation, which is, frankly speaking, catastrophic, taking into consideration that the massive destruction of the health system, which is by itself a major challenge in rebuilding the system or reaching the situation which is prior to this conflict inside the country. So that's one point. Second point is that this campaign is a great maybe opportunity for advocating and raising awareness about the situation in Sudan. But also, how can we think about different target audience taking into consideration partners? They are of different categories. So can we think about donors, for example? This is a special category, and they are highly politically oriented and they need maybe special approaches. They will not enter into details. And then we can think maybe on a bridging conference or something like that, similar to having more allocated funds. How can we ensure also that other partners, technical agencies are on board and they are also advocating for in the same direction? So this is different maybe approaches that needs to be taken into consideration. Last point is how can we also use in our advocacy the cross-border effect of the current conflict. So it is not purely Sudanese business, or it is not only affecting Sudan internally. Definitely, there will be beyond the borders, this will be regional, global implications of such destruction and in ability of the system to respond to key major problems. Well, I can just give very few examples. Now, for example, malaria. Malaria program is almost what have been gained over the last maybe 2 decades can be easily and is now unfortunately lost. There is outbreaks of malaria everywhere, and we cannot guarantee that will not affect neighboring countries or be a problem for others. We know now for the low coverage of immunization, Sudan was struggling despite the very difficult situation. Coverage was reaching 90% and 85%. Now with the last estimate, it is less than 50, and in some of the localities it is below 30, which means that there is no immunity we can guarantee with such very low coverage. And definitely it will have an effect. You will know all the outbreaks of polio in our region, either wild polio viruses or CVDBVs, and that can continue. Other VBDs like diphtheria, like measles. The effect of this needs to be also advocating for it in a more maybe comprehensive way. So that's just 3 points of brainstorming, and definitely there is too many areas that needs to be furthermore discussed. Thank you, and back to you, Dr. Haytham.
Thank you. Thank you, Dr. Majid. For the sake of time, we will now, Professor Omar, please.
Excuse me, Doctor. I have to go to the airport. I think.
No, thank you, Your Excellency.
Some guests has come from Sudan.
Thank you.
Minister of Health, Minister of Youth, and she will come in 30 minutes, inshallah.
Thank you.
Excuse me.
Yes.
Okay. تحيات دكتور هيثم، كيف حالك؟ الله يسلمك. في امان الله. السلام عليكم.
السلام.
Thank you, Dr. Haytham. I am Maya Omar. I'm based in Leeds. I work at the University of Leeds. University of Leeds, especially the Nuffield Center, where I have been working for the last 30 years, have been working very, very closely in Sudan for nearly 15 years. And I feel honestly proud to be part of that long-term engagement in Sudan. We have offspring of the Nuffield sitting here, including His Excellency Haytham and Dr. El-Sheikh, and have worked very closely with very important people, Haytham, Bashir, and Munna, in the past. And from my side, and also from the Nuffield side, we would be very keen to keep supporting and working with Sudan in the years to come. I want to make a reflection on an issue that I really feel very strongly in my heart. Sudan deserves every support today. Why I'm saying this is because Sudan has been supporting and helping a lot of countries when they were in difficulties, including my own country, Somalia, when it fell apart, when all the institutions collapsed. Sudan was the only country who has taken hundreds of students who were trained as doctors, as engineers, as in social sciences. And today, wherever you go in Somalia, you see the hospitals are run by doctors who were trained in Sudan. you will see ministers, including the foreign minister of Somalia, is trained in Sudan. Sudan deserves to be paid back all what they have doing to the countries in the region. And one of my pledge is really for the countries in the Arab world to learn from what Sudan has done and take a lead in training Sudanese and also building the capacity of the human resources of the future of Sudan. I think if we include in that campaign that we are launching today an advocacy to all countries that we are calling the Arab world, who are doing very little to support Sudan, really very little, including not even allowing Sudanese to go to their countries, to really go and beyond what they are not doing and help Sudan in real terms. So this is really a message I would like that this campaign to take forward and to advocate with what we call our Arab brothers and whatever. I like, Haytham, you mentioned the crisis. How can we move from this crisis to opportunities? As somebody who is interested in health systems development, I'm aware that in most of the countries, the health system is in shambles, is not working. We talk about reforming what is going on. Sometimes when health systems are destroyed, I really like to see this as an opportunity so that when we are reforming, we don't repeat the mistakes of the former health system that was in place. We try to come up with a neat, proper health system that will serve the population of Sudan. So this is like, our long-term, we need to include this in the long-term strategy. We are talking of decentralization. I think we have to see how effectively that decentralization could be. I feel happy to be with you today, and I want to say thank you for all your interest in this forum. And I'm looking forward that this forum will not only end in talk, but it will be translated into action. Thank you.
Thank you, Prof. Umar. Really appreciate your words. And as we have less than 15 minutes maybe, and we would like also to listen from His Excellency. Maybe we'll have less than 2 minutes for per intervention. May I go next to Dr. Sheikh Badr?
Thank you so much, Dr. Haytham. As a Sudanese, I should be so much appreciative of what Infinite is doing in raising up this issue at this very critical time for Sudan. And I see that the objective of this this movement is not only mobilizing resource funds, but also highlighting the situation, mobilizing all types of resources. And in this meeting, we were listening to, glimpse of how could the human talent as well as a huge resource will be effectively used in our situation, and also mobilizing the soft power and issues related to supporting the Sudan and Sudanese at this very critical time. But despite the difficulties, one is full of optimism based on seeing what the Ministry of Health is doing in Sudan to keep things going, and what the Sudanese represented by the example of Saba and others are really doing. And still, despite the difficult situation in Sudan, I think there is a lot of opportunities, and the field for work is there. So while we all agree that our ultimate destiny is to stop this war as soon as possible, but again, the very reason for us being here is to address the difficult situation that we are in currently and to plan carefully for a reconstruction of the Sudan health system. So in brief, I'm personally engaged in a very important dimension, which is supporting the Sudan health system, which is the health workforce. And I think if we are not able to streamline the funding, I think we should be streamlining the interventions. So in my opinion, the aspect of the health workforce is a dimension that pulls the strings, because if we talk about priorities, these priorities can never be attained without addressing the health workforce. And I'm glad to say that His Excellency, the Minister, Dr. Haytham, colleagues in the ministry and other partners, including Infinite, IAF, International Academy of Public Health, the Nuffield Center in Leeds, Professor Salman, Professor Ibrahim Bani, and colleagues, we are all working on a comprehensive health workforce project to address the situation. And this actually speaks to very important and critical dimensions. Only I will mention 4 areas that are of priority. Area number 1 is supporting the existing health workforce in Sudan. And there are many ways and means, because we certainly technically know how to leverage technical capacity to address this area. The second is ensuring the continuity of health professions education in Sudan, the educational pipeline. And I think the time will not suffice, but there are impressive issues that are being exerted now by Sudanese universities and other health professions education institutions to work very hard to ensure the continuity of the education pipeline. The third dimension is addressing the migration and exit, including the diaspora contribution. And I'm sure that, and I'm glad that diaspora contribution came up strongly in this meeting, and it's part of the project, how to really institutionalize this and enable our very vivid and rich diaspora to contribute. And then the fourth aspect is putting all these together and strengthening the governance of the health workforce in the country at the time of the crisis now and for a reconstructed Sudan. So this is in brief the project. And as Dr. Haytham Bashir was saying, I think in the coming period we will be moving ahead with presenting the details of these projects, all of the projects, and then hopefully seeing something tangible in terms of supporting Sudan. Thank you so much.
Thank you, Dr. Sheikh. Definitely will continue. If I may call Kevin, then Mason. Yes, Kevin.
Great. Thanks, Dr. Haytham, and thank you, everyone. My name is Dr. Kevin Kane. I'm supporting MFINET and previously worked for CDC in the US for about 20 years. I'm not as much of an expert as hardly anyone in this virtual room is about Sudan itself, but I thought I would offer a couple of thoughts based on what I've heard. First, I think it's extremely clear that there is tremendous need, and it's also very, very clear that many of you have very specific ideas about what those needs are and how to address them. The second thing that's very clear is that those needs are not being met. You know, maybe some of them are, but the gap is very, very large. Haytham, I want to go back to something you said in your presentation. You outlined some reasons, some potential reasons why that gap might exist, and you said you'd send out a survey. To me, the most important thing I think we need to do now is to really understand those reasons well. You know, most of us here, many of us here are doctors or public health professionals or both, and we understand that whether you're dealing with a patient or whether you're dealing with an outbreak, the first step towards the solution is actually diagnosing the problem. And to me, it's essential that we understand, is there just not enough money being offered? Are there not enough organizations who are willing to step up into the situation? Or is there an information gap? Is it that people don't understand exactly where they could provide their help the best? Or is it coordination, which someone else mentioned? I think if we can make progress in really understanding what the reason is that's causing the gap that we see, then we'll be much better placed to use our efforts collectively to solve that problem. And it's so clear that we have to do that quickly because, every day that goes by costs lives, as we have already seen. So just thank you so much to all of you who are doing so much to solve this. I'm with you here to do whatever I can, and I appreciate those of you who have organized this forum.
Thank you, Kevin, and we appreciate your support since the launch of this campaign. Maysoon, and then Dr. Yusuf.
Thank you. Thanks, Dr. Haytham, and thanks, colleagues, for the presentation and the reflections and feedback. So I think I'll start by saying today marks 500 days since the start of this tragedy in Sudan. It has destroyed infrastructure, resources that are incredibly difficult to replace. And sadly, we lost our loved ones, we lost our friends, we lost many Sudanese who, and we lost also memories. So not to lose the future, I think, one, the war must stop, but again, we need to rethink the way the support was provided in the previous period. I think we have enough evidence to say that given the number of people in need of support, the size of the available aid, the size of the country, relief items alone are not enough. National systems are crucial to deliver humanitarian aid in alignment with what was presented and said by the esteemed presenters and all colleagues. And I think an investment in the national systems and institutions that are needed to manage the aid instead of establishing parallel system is essential. This includes bringing back the health information system, bringing back the supply chain management, supporting health facility to continue providing services, but also investing in national capacities on health workers to ensure that they are recruited to have a source of income and serve the people where it's relevant and where they are available. Having said that, we all have responsibilities. So the donors are to align and coordinate, but also the government of Sudan has responsibilities, yeah? We need to demonstrate that we are having a system for accountability. We need to demonstrate that we enforce that system of accountability. We need to demonstrate that we facilitate access of humanitarian actors and workers to the people who need the service. We need to show and repeatedly say that it's health for all, and health is for all. I don't want to lose my aunt who's living in Khartoum North now, who's diabetic or an infection or a lack of insulin because she's in Khartoum North now. So that's essential. The second one, and I'll be very brief, the response should also be people-centered. And when I say that, there is also a responsibility on all actors. But if I look at the donors, the systems of the humanitarian agencies now doesn't allow engagement at community level. What is really brilliant about the model of SAPA and all the other organizations is that flexible funding, innovative, close to the community, that enables a facilitated community response. That's not the norm that we have now. So I think when thinking the projects also, the responsibility of the government of Sudan is to bring other sectors. There are decisions that happen in other sectors, like the security is very important, but there are some decisions that could result in negative impact of the health of people and the lives of people. So it's important to bring those on board and have that multi-sector engagement in the coming response. The third element also is protecting the workers, protecting the communities. We know that in some areas, those who are providing services in the communities are not safe for different reasons. But that element of people-centeredness, I think, needs to be brought up clear in the coming phase. The last comment is that when it's brilliant that we'll have that dashboard that summarizes the needs and also the projects, and also that's a form of transparency that could help us all, as Prof. Muna said, coordinate our support and resources as expertise and provide that where is needed. But it's also important that when we are developing those projects, to ensure that we have a peace and conflict sensitive projects. A lot has happened in our society, which means that when we are designing the project, when we are prioritizing the geographical areas, whether we like it or not, we need not to exacerbate the social tensions that are there. We need not to contribute to the conflict. We need not to undermine the social cohesion that's already resilient, but that's also very important. So as all of you said, documenting the impact, communicating the plan, being transparent, being accountable, health is a right, maintain the transparency throughout this. And also we need to acknowledge the drawbacks that we have in the systems that are in place and work on improving that. Thank you, MFNet, for leading on this. A big, big thank you.
Thank
And
you.
over to you.
Thank you, Dr. Maysoon. And I can't agree more that we need to ensure the people-centered projects. So Dr. Yusuf, then Dr. Muhammad, and then Amal. If you can make your reflection in less than a minute, I would be
absolutely. Thank you, Dr. Haytham. Thank you. I'd like to build on what Dr. Sheikh said. And in these challenging times, the International Academy of Public Health, which is an academic arm of Infinite, is highly committed to stepping in and providing much needed support. Recognizing the urgency in Sudan, we are prepared to collaborate immediately with local university or other universities in the world to extend our support. By working closely with these institutions, we can offer flexible, accessible, and also context-sensitive training opportunities that meet the unique needs of learners in conflicted, affected areas. One few seconds, Dr. Haytham, if you allow me, I'd like to take this opportunity and I call for integrating research into humanitarian response. While immediate relief efforts are critical to save lives, conducting research during these crises is equally essential for understanding the evolving needs of affected population and ensuring that interventions are both effective and sustainable. Research can provide evidence also for advocacy efforts, pushing for policy changes that prioritize humanitarian assistance, protect civilians, and address human rights violations during the war. Thank you.
Thank you, Dr. Yusuf. And we'll have also the final reflection from His Excellency, Dr. Haytham. But before that, Dr. Muhammad, few seconds.
Yes, few seconds. Thank you. Thank you. Good evening, colleagues. Thank you, Dr. Muhammad, Your Excellency, colleagues. Just few seconds. I'm starting. Actually, during a recent visit to Sudan, I witnessed firsthand the tragic conditions faced by displaced people. The overcrowding IDP gathering points is overwhelming, with a severe lack of some services and critical shortages of diagnostic materials for infectious diseases. This happened even despite the commendable efforts of the Sudanese Federal Ministry of Health. So the situation still remains catastrophic. So from this, in this summit, in this what I can call it, please, I urge all stakeholders and the global community to come together and provide the necessary support, sustained international support and cooperation to rebuild and improve Sudan's health infrastructure is essential to help the Sudanese people overcome these challenging conditions. Thank you very much. Thank you for listening.
Thank you, Dr. Muhammad. Thank you. Dr. Amal Al-Fatih.
Thank you very much, Dr. Haytham, and I'll try to be very quick. My name is Amal Al-Fatih. I'm a public health professional, and I will summarize really in 2 points, as many of the colleagues have also addressed many of the points that I initially had. But to emphasize really 2 points, first is the community-based investments, the need to invest better in community-based interventions. And thank you very much again, Dr. Maysoon, for segueing much of the points that I needed to say on this area. And it is really the need to have much more focus on these community-based and human-centered intervention. SAPA colleagues, and I would like to applaud their effort and their dedication, have not only demonstrated a very well-established success story, but also a very much a reliable one, not only to this group, but I'm sure to many of other colleagues and partners that are not part of this forum today. Thinking then, how should this be further institutionalized and replicated? Also thinking through the dimensions of lack of accessibility, the issue that many of the colleagues today in the forum have constantly brought forward. We are aware that hundreds of our families, they continue to be present in their houses in what we can very much say besieged areas. And coupling this with the dire access issue that I've just spoken to, that is now proven to become protracted, unfortunately. Thinking then that investing in local communities with human-centered interventions should be further highlighted and brought forward. And the second point is the diaspora engagement. And again, thank you, colleagues, for approaching this from different angles. We are very much aware through demonstrated records of previous support. Sudanese diaspora have proven to have high skills, high motivation, with vast experience in healthcare across many, many areas. Thinking then how we can best mobilize this, but institutionalize it closer to the needs and encourage them also. I'm well aware that SAPA have a vast experience also in leveraging telemedicine and e-health platforms. They have aggregated a very, very good wealth of experience. Then thinking of the concept of virtual volunteering, especially now, not only with very specialized doctors that we are well aware of, but many of our colleagues that are fresh graduates and are willing to support, but are just eager to know how to. And they really want to offer and add value to the misery that's happening at the moment in Sudan. So the need for collaborative platforms and stronger but simplified means of engagement to further advocate that among communities, I think is really something that we should further think about. Thank you again very much, Dr. Haytham, and thank you through you to Infinite colleagues. I know this is the fruit of very long weeks of preparation, and I'm really happy to see that we've come this long way. Thank you very much.
Thank you, Dr. Amal. And I think Dr. Haytham, now after listening to all those invaluable comments, ideas, maybe you would like to continue with your previous talk and also to build on what you have been listening to. So back to you, Dr. Haytham, and then we will conclude in a few minutes with Dr. Mohammed. Thank you.
شكرا جزيلا. Thank you very much, Dr. Haytham, and thank you very much for all attendees, from experts, from international leaders in health and public health, over 200, I think, attending this meeting. Thank you very much for the team preparing for this, from Infinite and the colleagues. I think I heard more than expected. No need for my presentation again. I had invaluable advices and comments, of course, will be leading the future of our health system in Sudan. Yes, I do agree with those say that the main challenge for the health system for Sudan now is not funding, is not the inaccessibility. The main challenge is the continuity of the war. And all we do believe that this war should come to its end. But at the same time, we ought to continue as a health professional. We ought to continue despite the challenges to save the lives of the people. We ought to continue, and we should continue the work we are doing for the purpose, for the sake of our people. We always in Ministry of Health we say that رغم الحاصل لازم نواصل. Despite the situation, despite the challenges, we should continue, and this is our slogan and for the last year. From this forum, I would like to come with two big conclusions. The first one is we need to be the voice of 48 million Sudanese people. Now, of this campaign, and I'm sure that over the next 3 months, these 200 will be thousands. And if you have thousands have the same voice, calling for supporting the children of Sudan, the mothers of Sudan, the people of Sudan, of course, together we can do the best for the people of Sudan. This is the first message, and I would like all of those attending this meeting to be part of this campaign led by Infinite. The second conclusion message is from our side in Ministry of Health or in the government of Sudan or supporting diaspora or health workforce, we need to enable the environment and to facilitate for the partners. We need to demonstrate the capacity that we can absorb, we can facilitate. If we see the number of partners working, the number of organizations working in the country are many, and their number is not proportionate to the size of the work we expected in the country. That means there are the challenges, that means there is many difficulties. From our side, we need to enable the environment. We need to provide the needs, provide the projects, provide the programs, provide the information, the way forward, the most expected scenario to work with. We need to work on that, and I need your support as technical experts attending these meetings, either working directly with Minister of Health or institutes in NAFEL, in EAF, in Infinite, in other organizations. I need we open our hands for you to provide the technical support from your experience, from your thoughts, how to making the environment suitable for the international partners to play their maximum role towards supporting the health system. And in person, Haitham and Muhannad, very much for this, and to thank Infinite team, and to thank Infinite for sponsoring this campaign. And of sure we'll see the fruits of this campaign soon, prosperous and better life of the people of Sudan. Thank you very much, and over to you.
Thank you, Dr. Haitham. I think very clear messages, and we can't agree more. I can see in the comments that all are committed to participate and to support our people in Sudan. I know that we have passed a few minutes, but I really would like to ask Dr. Muhannad to have a conclusion and closing remarks for this webinar. Thank you. Back to Dr. Muhannad.
Thank you very much. And I think it's really very informative forum. But allow me also to stress on the important, as Dr. Salman and His Excellency mentioned, that maybe بالرغم الحاصل لازم نواصل, but I think this initiative has to take a new arm, which is that we need to say as a public health people that we do not accept, and this situation should be. It could be a petition. So we have now two arms for this initiatives. One, to focus on how we can support Sudan and how we can save, the lives in Sudan, and how we can improve the health system in Sudan, which is very important. However, also we need to send and start, launching a petition that should be stopped, and we are as a very professional people that we are calling to save lives for our children, sisters, mothers, elderly, and all people in Sudan. So I think this is very new additives to these initiatives, and it can go parallel at the same time. I think, all of us, this is, to best of my thought, this is a very good start. And as I said, and many colleagues said, this is the first milestone, and that we can build on it. And we see that many of our regional, international, and the global community are very, very engaged, and no doubt that colleagues from Sudan are always very proactive, and they have the best capacity, one of the best capacities in the world, that really they can support Sudan. Of course, also we have the opportunity with the globe, the voice of the globe, the voice of international community to join these initiatives. Really, I would like to thank all of you for attending this webinar. Thank you for being part of this. I think many of the critical points had been raised, and it should be added to these initiatives, like community engagement, specification, and others, many workforce, special operation, and many of the new things that we need to consider. At the same time, we have to send a clear voice, to take care of our Sudanese people, those who always we have learned from them, and we always were wishing to be like them with their, good attitude, with their knowledge, experience, and others. So really, I'm very proud and honored to be part of this, and I'm very happy that we could make this first step. And very clearly, we are welcome for any partners to join. It's not only Infinite, it's about, how we can better support Sudan in such critical situation. So thank you very much, and we are looking forward to continue this effort and discussion during face-to-face during our conference, Infinite Conference, in September, mid of September of September. So thank you very much, and you are most welcome. Thank you.
Thank you. Thank you all. Assalamu alaikum.
Assalamu alaikum.
وعليكم
جزيلا